Hello everyone. In this video, I am going to present about the community pharmacy management. In this, let's see about a selection of site, space layout, and design. Introduction. In the last census, India has crossed 1 billion population with an exponential addition of 30 million population every year. So, in this decades, India has crossed several number of population. Due to overcrowded population, there is more poor sanitation, limited medical facilities, like that. Because the people population are growing, but the sanitation is low, and medical facilities for those peoples are low compared to people's population. So that due to poor sanitation and low medical facilities, there are more diseases like infectious diseases like malaria, filariasis, tuberculosis, leprosy, cholera, gastroenteritis, helmintic infections, polioids, and other sexually transmitted diseases are spreading more due to high populations. Malnutrition disorders like anemia, vitamin deficiency diseases are also in high risk. Since independence, also the governments are introducing many healthcare programs for improving the public health. Maternal and infant deaths are not yes. Government is trying to provide to stop the diseases. Government are trying some facilities, but even though the infants and maternal and infant death are crossing over. In urban and semi-urban areas, the problems are different. Yes, in urban areas are social habits like cigarette smoking, chewing pan masala, alcohol consumption are increasing and leading to many diseases. Yes, in urban areas, in village areas are all there are the peoples are going towards the smoking cigarettes, pan masala, like that alcohol consumption. These are the major risk factors for several diseases. Taking this can lead to several diseases like asthma, COPD, hypertension, diabetes, gastrointestinal diseases, liver disease, and etc. Most of the people in the production age group are becoming slaves for this social habits and becoming burden to the society. Yes, some people are becoming slaves for this kinds of social habits, and they are becoming the burden to the society. In communities, when people become sick, they will first visit the medical store for receiving the primary care. If symptoms do not resolve, then patients will go to the clinics for consulting the doctor. Yes, first of all, they will visit the nearby clinic or pharmacy store. If the symptoms is not reducing, means so then only they will visit the hospital. In India, people often call community pharmacists as medical stores, medical shop, medical and general stores. Yes, mostly they will call the community pharmacists for their treatment. Community pharmacists are suitably qualified and are in the right position to help such people by providing the right medication for right patient with suitable advice for medication usage, conducting awareness camps, group counseling and smoking cessation program, and other healthcare programs. Yes, the community pharmacists have several knowledge, right? They have the capability to educate the patient about medication usage, and they also have the capability to conduct awareness camps. They will provide a group counseling and smoking cessation programs also leaded by the community pharmacist. The community pharmacy is defined as a place where medicines are stocked and dispensed to the patient or patient caregivers under the supervision of a qualified and registered pharmacist upon the production of the prescription or when legally permitted without the prescription. Yes, community pharmacy is a place where the prescription drugs will be prescribed drugs will be filled and dispensed and the stock all arranged and there will be at least one qualified person and the registered pharmacist. There will be more qualified persons and there will be one at least one registered pharmacist to check the prescriptions and legally permit the prescription. Community pharmacy is not only a place for professional services, but it's also a business establishment. Success of community pharmacy depends upon various important aspects such as local location of the pharmacy, design of the pharmacy, display of the goods, approach of the pharmacy personnel, and the provision of the patient care services. Pharmacy is not only a provisional professional service; it is also a business establishment. And the business depends upon the location of the pharmacy and the design. This are play an important role of the in the business of the pharmacy. First of all, site selection. How we can select the site for the pharmacy. Although community pharmacy practice is a profession, but predominantly it is a trade. So apart from providing the services, it's essential to take suitable steps to improve the business. Yes, it's not only a profession; it's a trade. So apart from this, we have to take steps to improve this business. Before starting the pharmacist should do a macro survey of the area where he or she is intending to start the business, such as population size, number of the practicing doctors, number of medical stores existing around should be taken into the consideration. Yes, before starting any pharmacy, first we have to select the site where we have to start a pharmacy. We have to decide it. During deciding the site of the pharmacy, the pharmacist must take notes about the if we select an area to keep a pharmacy means we should take a survey for how much population was in this area and how much practicing doctors was in this area, and already whether there is any medical store or how many medical store is there in this area. We have to take this notes and select the site selection, the suitable sites for there are more suitable sites for opening the pharmacy. 6 major sites: attachments to the clinic, close by the clinic, nearby to hospital, in a busy market, growing city extensions, close by to railway station or bus station. First, attachment to the clinic. This is the most suitable site for opening a pharmacy. The prescriber will send you a very good number of prescription based on the rapport with him and the service you give to the clients. Yes, if you start a pharmacy near a clinic, the prescriber will send all the prescription to your pharmacy only, and you can also get some clients. The advantage of this kinds of setup is regular prescription feed. Yes, regularly we can attend the prescription. Substitution may be permitted when the prescription brand is not available. Yes, because the clinic was near and the prescriber was near, so that we can substitute the brand after asking to the prescriber immediately. We can ask the prescriber and change the brand which you have. Patient may also consider the pharmacist as first of contact for health related information, because the pharmacy was near the clinic, so if they have any doubts means also they will ask the pharmacist about that. Next, close by to the clinic. It is also considered as a good choice to open a pharmacy close to a clinic. Mostly in a clinic near in a colony or a market where there is a clinic. Advantage of opening a pharmacy in such area is good prescription feed from the general practice. The permission for substitution when prescription brand is not available. Yes, here also we can substitute if the prescription brand is not available. Good customer rapport. Customer will be good. Opportunity to we can also give OTC medications because the clinic was nearby. We can freely give that. Freely means without any afraid about that we can easily give the medication. The pharmacist in cooperation and taking the confidence of the doctor can provide pharmaceutical care services such as counseling, drug therapy management through health screening services. Yes, we can also give health screening services, health like BP checking, sugar checking. This also we can provide in the pharmacy itself. Then the services will improve the patient confidence about the pharmacist as a healthcare professional and contribute to the success of the businesses. The services will provide the patient about the confidence to the pharmacist, and it will promote the business. Next is nearly to the hospital. Opening a pharmacy nearly to the government general hospital or any other secondary care or tertiary care hospital is also a good idea. The opportunity for the prescription feed will be as if you start a pharmacy near the hospital, then the prescription feed will be high. However, the pharmacist require maintaining wide variety of product range. With yes, we should have different brands because some doctors will prescribe another brand, some will prescribe another brand, so different kinds of brands must have in the pharmacy. If appropriate inventories are maintained, this is a good option. Yes, if inventory we maintain the stock means it will be a good option to keep the pharmacy near the hospital. Next, the disadvantages, less rapport with the prescribing doctor. Yes, for the we will not have a great contact with the prescribing doctors. Poor chances of the brand substitution also we will have no chances. Mostly poor chances. Maintaining more number of the brands also will leads to inventory cost. These are some of the advantages. Next one is in a busy market. Busy market are also considered as also right choice for opening the pharmacy. Because in these areas, due to the increased crowd, there will be more movements of the drugs. Public may visit the market. Mostly, when they travel only, they will ask many. They will come to remember many medications, so that they will ask they will visit the market to buy the medications along with purchase of the other commodities. They will also purchase this medications if the pharmacy was nearby. The pharmacy opened in the will depend upon the floating prescriptions, like coming through prescription. Success of such pharmacy depends upon the layout. If the pharmacy was built in a correct layout and design, beautiful design means it will lead the customers to visit health customers. They will come and visit the pharmacy if the design was so good means they will come voluntarily come and visit and buy the drugs and go. Water facilities, if we provide water facilities inside the pharmacy means the prescription also will be get sold. Patient care services as a counseling, healthcare services has shown. Yes, mostly now big pharmacy they have given cash discount. Cash discount is the major idea to promote the business. Then we can also counsel the patient. Counseling the patient will also help the patient to understand that this pharmacy is different and good compared to other pharmacies, so they will visit it regularly. Next, near the growing city extensions also is a good choice for the opening the community pharmacy. People in such areas will find in going to the market for emergency requirements. They will in emergency condition they must visit the pharmacy, right? So during that time and all, they will visit the nearby pharmacy and buy the medications. Counsel, we can also provide counseling, healthcare services. It will attract the more customers. Chronic patients like diabetes, asthma may require detailed counseling on safe and effective use of the insulin injection or inhaler. Yes, asthma patient they will mostly don't know about how to use the inhalers, and diabetic patients they will not know about how to use insulins. We can counsel the patients about this properly friendly manner, so that they will visit the pharmacy regularly. If they have any doubt they will freely ask the pharmacist. Then close up to the railway station or bus stop. Railway stations and bus stop are also considered as a good choice for opening the community pharmacy. The commuters may require medicines to get an immediate relief of coach conditions such as diarrhea, common colds, or body aches. Like this condition, the patient was near the bus stop means they will search for the pharmacy. So they will immediately visit this pharmacy. Next, availability of the pharmacy in close by to this areas will help the patients to purchase the medication. Mostly the coming medication prescriptions will be short in prescriptions. Along with the prescription medicines, opportunity for general sales will also be very high in contributing to the business value. Apart from the above, other important criteria required to be considered by the pharmacist will be. Apart from this, what are we have we can consider means parking space. Yes, there must be a parking space in front of the pharmacy close by the traffic light and traffic rules. Yes, we can keep it near the traffic lights, so that in traffic they will visit the pharmacy. Visibility of the pharmacy must be yes, visibility must be. We should keep a big board, and during night time we should keep lightning effect and all, so that easily they can identify the farmers. Expansion opportunity for the existing space we can expand. Clear negotiations with the landlord regarding the rent. Yes, rent we should properly maintain that. Facility for the temperature control for thermolabile medications. Yes, we should properly store the medications. Separate storage spaces for, yes, the scheduled drugs and poisonous drugs should be separately stored. Next, space layout and design. First we have seen site selection of space layout and design. In the modern world, the clients will always give importance for quality services in short possible time, especially in services oriented establishment. Performance preferences also will be given for entrance and ambience. Yes, mostly they will see the entrance and ambience of the pharmacy, then only they will visit the pharmacy. So ambience must be beautiful. To meet this demand, it is essential to have a new work system facility designed for the community pharmacy. The new work system should be developed to optimize the utilization of space, sales, personal time. In the new design, pharmacist should be able to review the prescription, check technicians' work, and dispense the prescription. Counseling patients is the pharmacist should counsel the patients about everything, counsel about the diseases and what to do, how to take the medications, like that, so that it will help the patient to visit the pharmacy regularly. Then the objectives. வீடியோல எடுத்துட்டு இருக்கேன் இப்போ சாவடிச்சேன் உங்களையெல்லாம் கொண்டு பூத்து புதைச்சி வச்சேனுங்க. The objectives of good pharmacy layout is to attract maximum number of customers. We should attract the main objective is to attract the maximum number of the customers, provide an appropriate opportunity for the customers to purchase more, create a pleasant ambience in the pharmacy, and provide basic amenities for the clients with maximum space utilization. The space must be more in a pharmacy, so that it will create a pleasant ambience for the patient, provide customer convenience and the satisfaction. The convenience and satisfaction must be the convenience provide customer convenience and the satisfaction of the customer has to be the convenience and the satisfaction of the customer is more important. Minimize the salary expenses through layout efficiency and space satisfaction utilization. Based on the layout and design, the pharmacists can be classified as prescription-oriented traditional pharmacy design. Prescription, the pharmacy design must be traditional. Super drug store pharmacy design. Then pharmacy with pharmaceutical care prescription-oriented traditional pharmacy design. These are the traditional drugstores which are commonly seen in the market as street side. This traditional drugstore is mostly seen around the market street. Major objective of such pharmacy is to serve the customer through filling the maximum number of the prescription and sales of other products to increase the business volume. This main role is to fill the prescription and to increase the business volume. Next one is super drugstore pharmacy designs. Super drugstore pharmacy designs are more common in the Western world. These pharmacies will provide opportunity for purchase of both prescription and other healthcare items like cosmetics. They also include not only the medications, they also include the cosmetics, baby care items, eye care, other gift items. In such pharmacy, along with the separate prescription counter, salesman supported health counter items, gift items counter will be present. There will be separate counters for each items. The pharmacist should also have a separate attached place to collect the goods and storage before the goods are displayed. The ambience and designs of the pharmacy are made in such a way to attract more customers with decreased purchase temptation. Along with the prescription items, sales for general items also must be contributed for the business value. Along with the prescription, we should also sales other items so to increase the business value. Next, pharmacy with the pharmaceutical services design. Pharmaceutical care is also responsible provision for the drug therapy to achieve the desired therapeutic goals. Pharmacists with pharmaceutical care services will have a separate patient care area for offering counseling and health screening services. There will be a separate areas for counseling, and there will be separate area for health screening services, along with the area for display of the medications and other healthcare items supported with a salesman service. The design should include a space for prescription counter, a separate counter for other health items, and baby car items, display and sales. The wrapping and billing counter should be at the entrance. Must be a separate counter for base item, prescription item, etc. And there must be a wrapping and billing section must be in the entrance. Optimum design characteristic of the pharmacy. The pharmacy should be painted with a specialized light, professional colors to give a serene, right, pleasant feeling of the customers when they enter the pharmacy. The pharmacy should be well illuminated with proper ventilation. There must be proper ventilation. The pharmacy must be painted nicely, and special light has to be attached. Air conditioner has to be applied. Basic amenities such as customer waiting area has to be there must be a customer waiting area, and it has to be put it with the chair, and we can also include magazines for reading while the prescription are filled with magazines must be given to for reading while waiting. There must be a washroom facility, water and coffee facility. If needed means we can add it. Next, a separate counter has to be made for a separate dispensing of the medication. Separate pharmaceutical care services for patient care, special counseling has to be done. Next, special health screening services has to be provided. Display of the healthcare item, gift item has to separate counter. Adequate fixtures and furniture should be maintained for stocking all the varieties of the medications. Next, yes, in this video what are we have learned means about site selection, how to we can select the site for pharmacy. It based on 6 types: attachment to clinic, close by to the clinic, nearby to the hospital, in a busy market, growing city extension, close by to the railway station. Here we also saw about the space layout, design, and optimum design characteristics of the pharmacy. Thank you.